Hi, I'm Lori Seibel, President and CEO of the Community Health Endowment of Lincoln. One of the things that we have worked really hard on at the Community Health Endowment is to fund transformational programs. We use transformational philanthropy to do that, and what that means is that we like to change systems. We look for programs that have the ability to build on themselves and to create great impact across Lincoln. One of the programs that we have been funding since its inception has been the Medication Assistance Program. Back in 2003, it was called the Grapevine Project, and the purpose was to fund prescription medications for individuals who couldn't afford them. Well, what we started with was a fund simply helping people pay for prescriptions, but we realized that wasn't going to work. We simply didn't have the financial resources to keep doing that. So we helped fund a person who did nothing more than to enroll people in medication assistance programs and be able to access their medications in that way. So for a much smaller investment, we were able to secure over $1 million and more worth of medications back to our community. Well, since that time, this program has grown. It's transformed into an even more sophisticated system of care for our community, and we want to tell you more about it and how that's happened. So we're here to talk about the Medication Assistance Program, formerly called Health 360. And with me to help do that is Joan Anderson, the Executive Director of the Lancaster County Medical Society, and Dr. George Hansen, a physician here in Lincoln. Thank you for joining us today. So Joan, tell us a little bit about the program, how it's changed and grown, and what it includes now.
Sure. Well, in essence, it really includes everything, and that's why we've changed it from medication assistance to medical assistance. We can help people with everything from finding their old records, which we get many calls about that for immunization records, to if someone doesn't have a primary care doctor with or without insurance, we can help with that. To for people who do not have insurance and need help with medications, specialty referrals, that type of thing, we can do with that as well. The other thing we do with the funds through CHE, we provide interpretation services to all of our offices via phone, which is not the ideal, but it is available because, as Dr. Hansen will say, that's one of the biggest barriers for the physicians to provide the care they need to provide for their numerous clients, because I think at one point we had 50-some dialects of different things that we were using.
At least that many.
At least that many. So that's huge. So in essence, we can help people with old records, a medical provider, a specialty provider, and all of these services are based on a sliding fee using grants from CHE.
So what started out as a program that funded just medications then has grown to helping people get a primary medical home,
Yes.
specialty care if they need that, interpretation and translation if they need that,
Right.
urgent care, all of those things. And I know even today there's a dental program that you don't run, but a dental program that's focused on very much the same model because this one works so well.
Exactly.
So
And
this
yes.
is that transformational model that we
Right.
love, and it's really a great example of how this
Right.
we've just layered on to create a system that works. So Dr. Hansen, tell me about what kind of patient you would see as a result of this program.
You know, I think it really encompasses the broad range of patients, anywhere from young patients to old patients, just a great diversity of ethnicities. My practice is in North Lincoln, so I've been up there for about 20 years. I've also been working with Joan on and off for probably close to that length of time in my role on the Lancaster County Medical Society Board of Directors, and have seen this program since its beginning when we first did just medication assistance and helping patients to navigate the pretty complex world of what's out there to help them when they don't have enough money to pay for their health care. My experience really has been that as this has progressed, that Joan and her staff are kind of the go-to people to help us when we have problems. And it's been a godsend for a number of my patients through the years. I can think of a gentleman just recently that we're still in the negotiation phase of him being willing to reach out to get some help. This is a gentleman who doesn't have insurance. He doesn't want to rack up large bills, but at the same time, we now have a program available. We have specialists on board, we have primary care physicians on board who are willing to work with us, who can provide help even in the absence of enough money to pay for that care.
Well, I know that the success of this program is in large part due to physicians like you who've been willing to work with it and work with your patients, so that's great. one of the things that I often am asked is, well, it's great, we get somebody a doctor and they're diagnosed with what may be the need for some kind of a further testing or evaluation or some kind of service, surgery or something like that. So what happens in that case? You get you see the person, you get them in, you say, yes, you need some specialized care. This has really been a great bridge to get people to that. And
Yeah,
a
I
lot
would
of
agree.
programs that doesn't happen. So give me a situation where that might have occurred.
You know, I had a gentleman that I think he was right around 57 who needed colon cancer screening. He chose a less costly test that was positive that then led on to him needing a diagnostic study, in this case a colonoscopy, but he couldn't afford it. He didn't have insurance, so we reached out to Joan, and via that we were able to hook up with a specialist who was able to provide him with that procedure, which fortunately came back normal. But I'd emphasize a lot of times our roles as primary care physicians and providers, because it's not only doctors who utilize the service, it's often APRNs in the community, PAs in the community who are working with physicians. And oftentimes the negotiation for us is really convincing people that there is a program like this out there, that somebody is willing to help them, in essence really without an expectation of a lot of money up front. So I think we need to emphasize that that's really fairly unique in our community.
Absolutely. And it's a credit to the physicians. I've often called this program like the clinic without walls.
Right.
It's out there and people can really be seen in a multitude of settings and get assistance to do that. And the physicians are compensated, not greatly. You're not going to be able to get, you're not going to get the highest level of reimbursement for this, but you will get something to cover some of your basic expenses. And so it's been in that regard, win for the patients, win for us, win for the medical society, win for the patients, certainly.
Well, I certainly haven't heard of anybody wanting to back out, and I think at least with what they do get reimbursed, they're covering their expenses.
Yeah.
And that's probably the most important thing for us, because I think in spite of maybe how people see things sometimes, we really want to help people as
Yeah.
often as we can.
I would just like to back up to the colonoscopy, because one thing we do in Dr. Hansen's case that he was referring to, this gentleman was over income for the patient, for the state program, over income for general assistance. But the other thing we do in our triaging is we make sure they are not available for any other programs out there. So one patient that Dr. Hansen's nursing staff, sometimes it's the nursing staff, take care of this for me, please. And so they called, long story made short, this young woman had an orthopedic issue, and it was going to be fairly costly, but we were able to get her on general assistance and help her that way. So it's not just the medical assistance program. We can help triage to see if there's other options there as well.
And that's great, because some people don't always know that
Right.
or they may be eligible at some point and not eligible at
Exactly.
another. One of the things I wanted to talk about that a lot of people don't realize, especially with the new Affordable Care Act, is the high deductibles that so many people face. They may have health care insurance, but they have very high deductibles. So give me how this program works with somebody in that situation.
Well, first of all, Dr. Hansen, you have a lot of that, I would assume, a lot of high
I
deductibles.
think the problem for us really is that patients don't quite understand what
Right.
that means yet. They don't know how to use the health savings accounts that come along with that. So there's some education involved there. I think you guys can help us with that
Yeah.
at times as
Yeah.
well. And at times there's nothing that's front loaded into their health savings accounts, so those deductibles need to be met in some way. So in general, though, when we've reached out, we've been helped. We've
Right.
Not really seen that as a roadblock.
What we have to do then is explain, if you have a $2,000 deductible versus a $10,000, sometimes it's just as easy for them to go through our program, and we can get the discounted rates, but they have to weigh the fact with, and this is with consultation with the physician too, is this going to be a major deal? Are we looking for possible cancer? He probably needs to just go ahead with that deductible, versus it's a hernia operation that at the most through our program is going to cost $900. They may be better off paying that out of their pockets.
Right.
So Dr. Hansen hit it right on the nail on the head, though, that it's the education of people buying the high deductibles. Sometimes that's a problem for many of his colleagues, I think. So education at that end is always a interesting thing.
And I want people to know this isn't a program, you've given a couple of examples, but this has far greater reach than that. So tell me about the number of patients, perhaps the kind of cost savings we're seeing as a result of this.
Oh, you're going to ask me cost savings. I report that to you in my report, but I don't know that I remember it. Yeah, it's a lot. I can tell you on average, just from the medical home, I want to make sure I get the statistics right. We get approximately 300 to 400 calls for assistance with medical homes. Now that's patients that need, maybe they're on Medicaid or Medicare. I know some of the consumers out there are saying, I lost my doctor and I can't find anybody who takes Medicare or Medicaid. We have a list of all of those, so that's about 400 a year that we get those calls, or someone who doesn't have insurance. Then 900 to 1,000 a year for specialty services, and that's for a CT scan, an MRI, or surgery, or a pulmonary consult, or just about any consult that you can imagine. And then as far as medication assistance, we have, now that we have the ongoing program you talked about, there's still the need, even though we can enroll them in a free program, they need an antibiotic. They need to get started right away. They just got out of the hospital and have heart medicines that they can't wait for a month to get on the program. We help about 200 or 300 patients with a one-time assist. Our program always is, we want to help people, but they have to have a follow-up plan. If that's applying for GA, if that's applying for the Affordable Care Act in some cases, if it's following through on getting a medical home, because clearly the people that need our help, they also need help with a follow-up plan.
Well, and talk about that medical home concept, because I think that with today's system of care, it's so easy sometimes to get care at maybe a one-stop, one urgent care situation, or at a volunteer clinic, or go to the ER and you think, okay, I'll just go in and get that done. But that concept of having a place where you can go for your medical care that knows you and has your records or has your kids' records, that understands what immunizations there's been, what drug reactions you may or may not have had, when you've had certain preventive tests. That's so important, isn't it? And we're trying to create that through this program.
Yeah, Lori, I'd say the medical home is the concept of it is still in development. You know, right now, I think most people think that the medical home is a primary care medical home, but oftentimes if a patient's major medical problem is kidney failure, their medical home may be their nephrologist's office, because that's the physician that sees them the most often. So we're starting to see that develop across specialties. But the concept, the idea you mentioned is right, that it's a place you can go to for information, so that you're not just getting episodic care, you're getting a place where the physicians, the nurses, the staff knows you pretty well. You have a go-to person to get that answer that you have a question.
I think it's important to know through our program, for example, if a patient of Dr. Hansen loses his insurance, and this has happened a couple of times, gone to Dr. Hansen for 10 years, looking for a new job, will most likely get insurance at some point in time. He and his primary care colleagues are always willing to work through our program for us to give them that discounted rate, rather than going to a new, say, People's Health Center, which will see everybody on a sliding fee. That doesn't serve people well. If Dr. Hansen has seen him for 10 years, now he can't pay or she can't pay, coming through us for a month or 2 months or 3 months until they get their insurance back, you guys have always been willing to do that.
And I think if we did one thing with this program, if we got that information out, if people understood that when they lose insurance, with a program like this, to back up and to catch that,
it's a bridge.
They don't need to look for somebody else. They've already got a medical home. They don't need to leave just because there's a perception that they can't pay. And more times than not, folks never ask. They either don't get care or they access it inappropriately through the emergency department or someplace
They're
else.
afraid to call you because they can't pay you.
Yep.
And so you're right. I think that would be one message. If we got that out there today, that would be well worth it, because we get calls from people frequently that I'm almost out of medications. The doctor won't reorder it without seeing me because you have to run tests or whatever. You can't just automatically order some of these scripts without seeing them.
Even then, most of the time we're pretty reasonable as long as we feel the patient's been compliant. But even within that there's only so much you can do
Right.
in a situation where perhaps continuing a medication might be dangerous, and we don't know, we
Right.
don't have the information we
Right, right.
need to make that decision.
Well, in a lot of respects, it's almost too good to believe, for people to think,
Right.
okay, here is someone who's willing to continue to care about my medical care, even though I may not be able to
Right.
pay them. And so this program says, we believe so much that continuing care by a primary care doctor, by your medical home, is so important that we'll provide assistance until, things turn around for
Right.
you. And that's what we hope happens.
The one thing I really also need to toss in here is Lincoln is very fortunate to have CHE, number one, that can help fund these kind of programs. Number two, to have the medical society, and we have almost 600 physicians that belong to the medical society. That is not to my credit, or I'm not sure who to credit, but Dr. Hansen and his colleagues, everybody, it's been that way for forever. Since I know, they all belong, and so they are vested in the program. But in addition, the two community hospitals are huge in this effort. CHI St. E's and Bryan Health. We have somebody who needs a CT scan. They can go to the hospital, apply for assistance for the facility fee, and then they only have to pay the radiologist. Or they need surgery. Yes, I can get a hernia surgery for maybe $800 for the surgeon and the assist, but then they've got the hospital and the anesthesia. And the hospitals give hundreds of thousands of dollars, I think, every year, both of them, in financial assistance. All of those things kind of go back to Dr. Hansen's statement that they're afraid to ask or they don't ask. When we talk to them about that, we explain that. There's 3 different things we need to look at, and you'll need to do this, that, and the other.
Well, and speaking of that, what are the restrictions, the criteria, any limitations for anyone that may be thinking, oh, this might be for me?
Right.
What do they need to know?
The biggest limitation is CHE funding. No, the biggest limitation is because CHE is Lancaster County funding. City funding.
Yeah.
We really have to use it for Lancaster County residents. So for example, I just had somebody from York who I think we're working with her because it looks like she'll probably have cancer. Somebody from Eagle that has a little guy that needs some special things. But again, our physicians will work with them. We have to require that they pay that discount up front because we can't use grant dollars. But for those options, like this one individual from York, she does have family that's willing to pay, and we just went through this whole thing. They're going to pay $583 versus $4,000 for the imaging the different things she needs, biopsy, imaging, and whatever. That most likely she'll get on Medicaid anyway, and then that can, but that's the limitation, is we do hear from a lot of outside of Lancaster County that, and reasonably so, this is city money, we have to serve the residents here,
Yeah.
but again, the physicians are willing to work with anybody at those discounted rates. So it's a limitation, but it's not an impossibility.
But it may serve as an example to physician groups, the hospitals, the other towns, that these are programs, even with a little bit of seed money in the right
Right.
place, something like this might really work.
Exactly.
Yeah.
And the most important thing, I think, is the communication and patients knowing that they can reach out for help. So that's good news that you're seeing some.
Yeah, and we
interest
see
outside the city.
quite a few from outside because they go to People's Health Center, or they're referred to a specialist, and then we go through that way. So I would say we do have some limitations, but we will do absolutely everything we can to help anybody who needs help.
Well, what I would say is that when Lincoln General Hospital was sold back in 1997, and the Community Health Endowment was created as a result of the sale of that hospital, the proceeds from that sale were put into this fund that helps fund programs like this. One of the concerns at that time, and it was a very difficult time to sell a community hospital, but one of the concerns at that time was that these funds be used to help people at highest risk for the poorest outcomes, often as Lincoln General Hospital did. And this program speaks volumes that is how those funds are being directed and being used. And just huge amounts of credit to both of you for not only developing and operating the program. I know, Joan, people know your number by heart, and we'll give it out here in just a moment. But Dr. Hansen, for your willingness to be an example among physicians to do this. And so at a time when the world seems more divided than others, I think we can agree that this program speaks to what collaboration and cooperation can do, especially as we reach out to help people in our community who are struggling. So if you are interested in knowing more about the Medical Assistance Program, MAP as we're calling it, call 402-483-4800 and someone from the Lancaster County Medical Society will be able to help you. And we'll close our program with my big thanks to both Joan and Dr. Hansen for their words of wisdom and for their support and operation of this great program. Thanks very much.
Thank you.